Hi, welcome back to Orion Family Health YouTube channel. I'm Dr. Monica Bartoli. I am the owner and solo physician at Orion Family Health, which is a direct primary care practice serving the South Florida area, primarily Broward and Palm Beach counties, and we are a house call based practice, so I come to you. So today's episode is going to be very fitting for the month of October. We're going to talk about breast cancer awareness. So you have probably seen, even though it's only October 2nd, pink ribbons everywhere. I have them on my nails. So October is Breast Cancer Awareness Month, and us in the healthcare field, we like to take this opportunity to remind ourselves as well as our patients about breast cancer screening, education, treatments. So we really try to dive in and make sure it's at the forefront of our conversations. Sometimes in health, we start dealing with other things, other disease processes, and preventative care goes to the wayside. So these awareness months are there to help remind us that we need to talk about this with our patients. So if you are my patient, get ready. Every visit, I'm going to be asking you about your mammogram this month, and if you're overdue, we're getting you an order to get one done. So let's start out with, in general, what is cancer? I like a very simple explanation for this. Cancer is very, very complicated on a genetic and molecular level, but when patients ask me, so what does cancer even mean? I like to explain it in this way. So every single day, your body's cells are dividing rapidly, repairing things, making new cells, and as much as we want the body to be perfect, it does make mistakes sometimes. So we call these cancer cells. Your immune system should activate and say, oh, this one's no good, and take out the trash. However, sometimes the immune system's not functioning very well, whether it's from external factors, or sometimes you make these wrong cells because you have a genetic predisposition, and that's when cancer occurs. I always tell patients, when the amount of bad cells is too much for the immune system to handle and they're replicating faster than you can take them away, that's cancer. So specifically, we're going to talk about breast cancer in this episode. So breast cancer is when those really bad cells multiply and congregate in the breast tissue. Now, the Susan G. Komen Foundation has amazing stuff on their website. So if you're looking for a good resource, you can go to Susan G. Komen's website. You also can go to breastcancer.org. They have great information. But it's estimated that 1 in 8 women will be diagnosed with breast cancer in their lifetime. So it's a real thing. So when we're talking about breast cancer, of course, we'll talk about screenings. The accepted standard of screening is a mammogram. Now, there are 2 guidelines. The American College of Obstetrics and Gynecology recommends starting at 40 years old and getting a mammogram every year. And most gynecologists recommend that. Most cancer societies recommend that. The United States Preventative Task Force says start at 50 and do it every 2 years. So their recommendation is a little more loose, if you will. I usually have a conversation with my patients. So guidelines are there to guide us. They're there to help us standardize some of these screenings. However, medicine should be tailored to my patient. So if I have a patient who tells me, Doc, I'm not worried about breast cancer, nobody in my family had it, I don't wake up at night thinking I have a lump, then they might be comfortable starting at 50 and doing it every 2 years. However, if I have a person who says, I have breast cancer in my family, I've had lumps before that caused me great anxiety, well, that might be my patient that starts at 40 and does it every year. So I really try to tailor it. So mammograms are the accepted screening tool. I have heard of other types of tools people use, like MRI, thermogenesis. They all may have their place in diagnostics, but they're not the recommended screening test. So mammograms are X-ray technology, and most older women know when they go, there's a machine, and your breast gets put on a platform, and it gets compressed. It's not a very comfortable test. I've never had anybody jump for joy that they're due for another mammogram, But what it does is it takes an x-ray picture and shows us if there's any calcifications or spicules or irregularities in the breast tissue. If you have implants, hopefully your implant is placed under the pectoralis muscle, so mammograms are perfectly safe for you to have. That's one of the reasons why surgeons defer to that technique. So there are 3D mammograms out there, meaning it's the same type of radiation, it's the same x-ray test. However, it's a different mapping and they can generate a 3D model. And it shows us a little more in-depth picture, especially with dense breast tissue. Some insurances may cover this, some may not, but there is an option. So you can have a traditional 2D mammogram or you can have a 3D mammogram. Depending on my patient's history and their breast tissue, I will recommend one over the other for various reasons. So let's talk about screening that you can do outside of the office. There has been a lot of controversy over the years of self-breast exams, or SBEs, self-breast examination. I, as a doctor, 110% take the stance. You should know what your body feels like. You should examine your body, and I'm a proponent for self-breast exams. We can catch things early when you know what normal is for your body and then you feel something abnormal. That gives us the best chance. Hopefully we're catching it early. So I recommend self-breast exams to everyone. How I recommend doing them is that you do them around the same time every month, preferably away from your cycle, because as you start to get close to your menstrual cycle, the breast tissue changes. Some people are tender, sometimes you get lumpy bumpies more. So I always say a week out, maybe 2 weeks out from your period should be a good time to do it. You start in front of the mirror and you look at your breast. You look for, is the nipple normal? Nipple retraction can be a sign of breast cancer. So you want to make sure anatomically everything looks fine. Are they hanging normal? No breasts are equal, so most people have one that's larger than the other, but it shouldn't be this big, huge discrepancy, and it shouldn't be a change for you. The other thing I tell people to do is while you're looking at yourself in the mirror, raise your arms up over your head and watch the breasts rise. They should do that symmetrically. And also you can put your hands on your hip and you lean forward and you watch them fall. Again, they should be symmetrical. The rest of the exam you can do when you're in the shower. I recommend you take your arm and put it up over your head and you start up here kind of by the shoulder area. So you don't just stick to the breast. Up here by the shoulder, because there's an anatomical structure called the tail of Spence, which is actually breast tissue that goes all the way up. So hand on your head, start up here, and you just work your way down and feel your breast tissue, and you can use this type of motion all the way until you get to the nipple. Once you do that, last step is always get in that armpit. That's where the lymph nodes are for the breast, and so you can detect a lymph node in the armpit there. Of course, you do both sides. So what do you do if you find something? Lots of women have little lumps and bumps in their breast tissue. Breast tissue by nature is lumpy bumpy, as I call it. So the first thing I recommend is if you feel something that is not your normal lumps and bumps, you call the doctor. You can call your primary doctor. It doesn't have to be a specialist. It doesn't have to be an OBGYN, but you call and say, I found something on my breast exam and I'd like to be examined. Generally, when patients tell me that, what I do is we do a breast exam of both sides, not just the problem side. And then I can usually get a feel for if this is something scary or something normal. However, a breast exam by a physician is not diagnostic. I always tell patients, it feels like a cyst, it feels like it's maybe a fibroadenoma, but we're gonna get a mammogram and ultrasound to make sure, okay? The last thing I wanna do is provide reassurance on something that could be scary. I don't have a crystal ball. So generally, when you do find something, your doctor will give you an order for a diagnostic mammogram and an ultrasound. A diagnostic mammogram is a little different than a screening mammogram in the sense that it is not preventative. We are looking for a problem. So this may not be covered with your insurance as your preventative benefits. You'll be responsible for your copay and deductible and all of that with that test. It also looks really just at the problem area and focuses on that problem area instead of a generalized screening. We do an ultrasound with it because x-ray only shows us, how I like to say, hard and soft. It shows us what's bone and not bone, or calcified and not calcified. But what if it's a cyst? It does not show us on x-ray if there's liquid inside or if it has blood supply or if it's solid. So that's where the ultrasound comes into play. Once you have that done, the report will be sent to the ordering doctor, and then you can have a discussion. I love when I get to call people and tell them, oh, it was just a cyst like we thought, it should go away. Or, oh, it was just a fibroadenoma, it looks like it's no big deal, let's monitor it. But sometimes something suspicious does come up. And when I have those conversations with people, first of all, I like to do them in person. I never want to call a patient and tell them that something like this could be occurring to them. So I try to get them in person, even if it's a video, so we can talk about it. And the other thing is I move right away. So if your doctor sees something suspicious on your report, the next phone call they need to make when they're done speaking to you in whatever manner that is to a breast surgeon or an interventional radiology department. And whoever can get you in first is going to do your biopsy. Generally, the surgeons who specialize in this, they understand the importance. We all want to move quickly on your healthcare team to get an accurate diagnosis and, more importantly, get you treatment if you need it. So at that point, my job as a primary care physician is done. I hand my patient to the breast surgeon and I stay there for moral support and to help with understanding of the process, basically. So there's several different types of breast cancer. Ductal carcinoma in situ is a very common breast cancer that happens, like it sounds, in the duct. In my short career, it's been the most prevalent that I've seen. I always defer to breast surgeons on management of that because there's been some change of thought and guidelines in how we approach these now. You want to catch breast cancer before it spreads. That's when it's called metastatic breast cancer. And again, it involves lymph nodes. But it also likes to travel to the bone, the brain, the liver, the lungs. So we really want to catch these early. That's why prevention is so important. Now, you might be wondering about what about genetics and the BRCA testing. Everybody knows about that. So if you have breast cancer in your family and somebody has had the BRCA gene mutation, it is recommended to consult with your doctor about possible genetic testing. Now, just because you have a gene does not mean you express it. So the ethics and the advisement of genetic testing is extremely personal. So you should have a really well-rounded, complete discussion with your doctor about this. When I advise patients on BRCA genes, especially women, my one question to them is, if you come up positive, would you get a prophylactic mastectomy? Because that's something to think about. So there's a lot that goes into genetic testing. It's not something you should just get a kit and do, because the results can be very impactful. Even if you're negative, that doesn't mean you're not going to get breast cancer. It just means you don't have the BRCA gene. So have an educated discussion with your physician about if BRCA testing is right for you and should be done for you. Let's not forget about the men, though. We do pink because pink is a traditionally woman color, and breast cancer is traditionally a woman's issue. But men can get breast cancer as well. It's estimated that 1 in every 800 or so men are affected by breast cancer. And so it's not impossible, even though it's way more rare. So men, if you feel something in the tissue overlying your pecs or your breast tissue and it's not right, give us a call. Signs of problems, I know I touched on it a little bit with the nipple. If you have any bleeding from the nipple, any discharge from the nipple, not normal. If the nipple starts to invert, and you don't usually have inverted nipples, not normal. If the skin texture changes on the breast, if you start getting pain in the breast that's not associated with your menstrual cycles, those are not normal. So please be open with your doctor. Sometimes when we talk about areas of our body, patients can get embarrassed or feel silly. It is not silly. And if your doctor makes you feel silly, find a new doctor. There are plenty of us out there that want to help you and that want to guide you and will never, ever, ever make you feel like you're just being paranoid. So if you need help finding a doctor, if you're in the South Florida area, call me. I'm taking new patients. But if you're looking for somebody that's not in my area, I'll be happy to at least point you in a direction with a website or a colleague that I may know to help you out. So I hope this was a little informational, reminded you about the importance of breast cancer screening and breast cancer awareness. All month long, you'll be seeing pink, pink, pink. So get your ribbons out, get your nails done, put the pink stripes in your hair, and I'm going to use this as every opportunity I can to talk to my patients about it. Any questions or comments, please drop them in the comments. I'll be happy to address them. Also, if you want to see more videos like this, hit the subscribe button so you'll be informed every time I drop a new one. Thank you and happy October, everybody.